And now on the line is Nadine Ferris France. And Nadine is the Executive Director of the Irish Global Health Network. Nadine, welcome to the programme.
Thank you so much, Darren.
Okay, Nadine, this is my first interview with you and your organisation. Could you start off by telling me a bit more about who the Irish Global Health Network are, please?
Yeah, absolutely. So we're an organisation that's been in existence for over 15 years now, and it's kind of as it says on the tin, it's a network that brings everybody together who is interested in global health. So those kind of organisations and individuals are often people who have worked overseas in Africa or Asia, for example, and who have come back to Ireland and are working in different NGOs, in the media, in academia, policymakers, and in the HSC. So health professionals, again, more broadly speaking, who are interested in global health issues. And we also have quite a few members who are also still based overseas as well.
Okay, go ahead. Yeah, sorry.
No, just the organisation itself. I mean, our job, our mission is to support people to come together, to share experiences, to learn from each other. The field of global health. I think before COVID, people probably wouldn't have known much about global health or have heard that term. But I think now after COVID, everyone has really understood how health really is global. And so I think our job is to bring people together, to help them share what's happening in different countries at different times, to try and learn from each other and to try and improve things, try and make things better by shared learning.
And can you tell me how many members you have in the network?
Yeah, we have over nearly 2,000 members of the network here, and then lots of other people who kind of come in and out and do different things in the network as well.
I saw somewhere, I don't know where it was during the week, that you had 500 members, so there must be a mistake somewhere. But I was looking at I was looking on social media earlier on the week, and I saw that your network actually has over 4,200 subscribers on YouTube. So you must be taken seriously by a lot of people.
Well, yeah, I think like I said, I think things changed during COVID as the network on global health. We were, in a good position to try and bridge the gap between, I guess, the general public and their understanding of health, and then all of the professionals who'd be involved in global health. So we did quite a lot of work. You might remember around there was guidelines for supermarkets, for example, at the time of COVID in Ireland. It's been growing. The network has been growing steadily, and yeah, well.
Okay, cool. I'd say so. COVID was a huge, and probably still is a big issue for you, is it? Yeah.
It absolutely is, and we were just actually we were preparing for this conference, which I know you're interested in learning a bit about next week, and we were just talking about COVID and how, COVID, it's easy for us to forget that COVID is a thing here where we get our boosters, and, it's just kind of kept at bay, but we're working with many countries where COVID, it's starting again as such, and even just outbreaks are happening as we come into the cold season here too.
Yeah, and there are loads of other issues, global health issues as well, that aren't kind of big issues in Ireland, but are huge issues in many other countries, like HIV/AIDS and TB and malaria as well. The use of people to work on them as well, yeah.
Yeah, we absolutely do. I was just, we have a conference coming up next week. So we do an annual conference, or we have been doing an annual conference for most of the years, and the conference brings, it invites everybody to share what they're working on, basically to share their experience. So we have people who are going to come and present on conflict and crisis, and people who are going to talk about maternal child health, or people who are going to talk about non-communicable diseases, for example, in Uganda, or a surgical crisis in Central and Southern Africa, and people who will present on TB. We have most of the NGOs like Goal and Concern and Trocra and others who will share, what the work that they're doing on the ground in countries like Zimbabwe and Zambia, working on many different issues. So global health is very broad. It covers everything from water and sanitation to non-communicable diseases to HIV, as you said, to obesity, and many different topics.
Yeah, it's a very interesting area. I've done loads of interviews over the last 10 years on global health, but I'm not I've no health qualifications. Um, is this conference you have at the end at the end of this month, and I know you have at least one conference every year. Is this the biggest event in the network's calendar every year?
It is, absolutely. We do a lot of online events and kind of, focused events, but this one is the biggest event that we have. I mean, this year we expect to have over 150 will participate, possibly more, and we have about 80 speakers. And I think, this year we have like women in global health is a very big issue. We're going to be doing a launch of the Lancet Countdown report. We have an interview with Sally Hayden. Maybe you know Sally, the journalist Sally Hayden, for her book. Yeah, very interesting book. We're going to be welcoming Mike Ryan to share his thoughts on health systems resilience on day 2, and a wonderful speaker, Robbie Lawler, who will talk about HIV and access to medicines. And we'll also hear from Colin Henry from the HSC, just his reflections on on the health system and how Ireland is able to respond, and also from Siobhan Walsh, the CEO of Goal, among many others. We're really blessed. We have a really fabulous amount of people, great people coming to share their experiences.
Okay, just a couple of quick questions on the conference. Yeah. Who is the conference aimed at? Like, is it aimed at health professionals, or is it aimed at the public as well? Kind of, you know what I mean? Like,
it's it's mostly aimed at health professionals, but the term health professionals, it doesn't mean like doctors and nurses. It means people who are involved and working in the areas of health, which can be very broad. There's a lot of people working, a lot of social scientists and people working in social issues that would have a lot to do with health. So, the general public, of course, anyone interested in health will be very welcome to come along and attend. And mainly it's aimed at the community of people who are engaged in global health work. So we do have, we're trying like everybody else to adapt. So day 1 is actually an in-person day in Trinity College are hosting the conference this year. And we're going to be doing a hybrid on day 1, and then day 2 will be online. And we're really happy about that because we have many colleagues in the field in countries in Southern and Eastern Africa and Asia who have a huge amount of things to share about what they're experiencing in health. So we're really glad that they'll be able to join us. I think COVID has helped us all to see what's possible.
Yeah, I know from being involved in journalism that across nearly every sector in Ireland and around the world, there's conferences on like every week on different things, like not just global health, but every area. I think a lot of conferences don't. My impression is they don't make a big amount of difference, but I get the feeling that at least your annual conference every year is it does make a big difference because the people who are attending, there's a lot of people attending, and it's kind of people that are skilled, so it does actually make a big difference, you think, yeah?
Yeah, I do. I think even just for myself, there's so much still to learn. There's a huge amount to learn, and I think that the conference gives you an opportunity to see what you don't know and to learn new things. And I think what's really powerful about the conference is it's very much a gathering of a community of people who are very interested, and they're really interesting people. People who have been working their whole lives on global health, and when they come together, it's like anything. You bring a group of people together and creativity sparks and collaboration happens and people get ideas and cross-fertilization happens and you start to see people meeting and, saying, God, I wonder if we could work together. And that's very interesting, your project over there. I wonder what we could learn for our project over here. So it's the impacts of that, of bringing a group together in in an organized way around key topics and themes, really does have, we notice a lot in terms of increased collaboration and just that sense of community. And I think, again, like every sector, we haven't been able to come together as a group in over 3 years. And, I'm looking at the program here this morning, just going through the final details, and it is incredible the work that people are doing, the things that people are actually involved in. We have over 80 speakers who are going to be sharing very, very solid work in all sorts of things. And it's like this conference gives you an opportunity to put a finger on the pulse of what's actually happening in global health. We're very lucky as well. This year we've a lot of partners, so it's a very big conference that's brought together a lot of partners to collaborate together, and our kind of main partners have been the University of Limerick and Goal and CBM, the NGO Oxfam, and also St John of God's Foundation, which we're really happy about because mental health is huge. And then there's a whole load of other partners like Trinity and Maynooth University and Concern and RCSI and Queen's University and many others. And I think even just coming together to plan this has been really, really useful.
That's great to hear, yeah. Okay, Nadine, it's great talking to you. To come towards the end of our interview today, can you give me out the contact details of the network in case any of our listeners today want to find out more?
Absolutely, I can. So I think the best thing to do is to just join the network, become a member. There's nothing to do except to join us, just to sign up on the website. It's free of charge, and that way you can receive information about these different health issues and just keep yourself informed. The best places would be our website, www.globalhealth.ie, and just start there. And for we're very interested in supporting young professionals as well, Darren, to come into this space. So if you're studying. If you're studying something or interested in becoming involved, sign up and do consider attending the conference. And if not this conference, then some of the other events that we have. In global health, there is a topic for all of us. All of us are affected by global health somehow.